I'm Hugh Lloyd Jukes, the Commercial Director of Oxehealth. The key thing about Oxehealth is we turn cameras into health monitors. So what does that mean? What it means is that actually the chairman of engineering at Oxford University and his research group came up with a way of taking all the wires from vital signs monitoring away and just using a normal digital video camera to get vital signs. So it's contact-free, medical grade, comparably accurate to a clinical device, continuous and totally passive. So frankly, it's a pretty staggering breakthrough. So we turn cameras into health monitors, and the kind of crazy thing about that is cameras are becoming ubiquitous. So our dream is that we'll be able to help people with their health through any camera that they choose to put our software on, because we're a software company. So what does that mean in practice today? What it means is that our first commercial product is already available. We're now piloting, following successful proof of concept, software that helps protect people in custody, police custody, prison, also patients in mental health hospitals. Between checks, are they okay? Are they at risk? And what you're seeing here, and I know you've taken some shots of, is something that's a little bit further out, but not that far out, which is totally contact-free heart rate and breathing rate monitoring in a hospital context. So I think what you see is that we're also talking to car companies and to elderly care companies. So there'll be a whole spectrum of places where people who are really good at providing custom solutions using cameras can use our software to provide vital care everywhere. But if you think about Lionel Tarasenko, who created this technology, his dream was you could be in Africa in a few years' time with a smartphone. You download one app, use the camera that's there, and you're giving a child intensive care quality vital signs out in the bush. So I think the ability to help care for people wherever they are is going to be opened up by cameras plus our software. So we were really keen to support DHEZ because I think what Ian and the team are doing is quite important. So if you think about what we're about, our dream, if you like, is vital care everywhere. So we can't afford to care for the sick, the elderly, in the way we currently do in hospital. We need to get them out of ICU, into other wards, out of those wards into the home, and we need to try and predict things. If they're in the car, or in their own homes, or out and about at work, how's their health, and how do we support them before they get into hospital? So that's our trick. Help hospitals and get things out of the hospital for lower cost and better quality of life and care. So when Ian told me that effectively what they're trying to do is join up the NHS, to join up academia and large companies and SMEs to try and create a better way of getting healthcare done for the North and for the NHS. We felt that was really important to try and come along and share what we've got and be part of the community. I think that you've got a lot of assets around Bradford. So Bradford University, some of the very innovative NHS trusts that are around here, and also the facilities that have been created here, not to mention the talent of Bradford, Leeds, and that whole area of the country. So I think you've got patient populations, you've got clinicians, you've got academics, and you've got, as you can see, an interest from SMEs and from large corporates. So I think there's a real chance, and I do think there's a bit of a hub developing around the north of England, which is actually how I come across Ian. So I think you've got all the assets. The tricky thing is to get the right blend of practical projects that people want to do and practical business and research being done. I'm not an expert in that, but I'm sure they'll figure it out given what they've got to work with. We're a software company, we don't make cameras, and so we will ultimately be working with partners who are already established providers of technology into the NHS or our private end users here or abroad. So at one level we'll work closely with partners. I think our philosophy in terms of trying to provide something that's useful is that if clinicians want it and love it, then we'll try and help them get it into their trust and to use it. We don't really think of pushing stuff into the NHS, and people talk about the problem of the NHS. I think fundamentally it's for us to give the clinician something they want, whether that's in mental health, forensic mental health, acute or elsewhere in mental health, in more broadly in acute NHS care, or in the police and prison service that we're also talking to. So we'll work hard on giving something that just changes the care pathway, and then we'll just work with whoever is interested in helping us get that to the patient. And I think DHEZ can definitely be part of that. The nearest community that we're a part of to DHEZ is something called the Digital Catapult in London, which is actually, I met DHEZ through an event co-organised between the two. And what I think they do very well there is we go to several of their events a year, and it's the casual collisions, if you like, where you bump into people. And we have had good clinician conversations from that. And also we've met a couple of potential partners there. So I think fostering events that are not just talking shops on broad themes, but actually quite practical, that attract a really engaged audience, is a great way of fostering connections. So I think connections, I think space, having a good place to work, are two things that I definitely think that following the digital catapult model that you could provide at the DHEZ.